The life-saving discovery of insulin, a story of teamwork and humanity. Welcome to MedGenio, your guide to inspiring stories of medical breakthroughs that shaped history. Today, we journey back to the early 1920s, a time when diabetes was a death sentence. This is the remarkable tale of insulin, a life-saving discovery born out of teamwork, determination, and an unwavering commitment to humanity. Imagine a world where diabetes was a death sentence. A time when a diagnosis meant inevitable decline, with no treatment to stop the disease. That world began to change in the early 1920s, thanks to the incredible discovery of a life-saving hormone called insulin, a story of determination, teamwork, and compassion. The journey began in May 1921 at the University of Toronto. Frederick Banting, a young surgeon, teamed up with Charles Best, a physiology student, to tackle a daring hypothesis. With the support of Professor J.J.R. MacLeod, the experiments commenced. Using ligated pancreases from dogs, Banting and Best worked tirelessly for months. After many trials, on July 30, 1921, they succeeded. Their crude extract, later called insulin, dramatically reduced blood sugar in diabetic dogs. It was a breakthrough, but the extract still needed refinement for human use. By late 1921, James Collip, a skilled biochemist, joined the team to purify the extract. Their hard work culminated in January 1922 with the first human trial. Leonard Thompson, a 14-year-old boy with severe diabetes, received insulin. The first dose had little effect, but with further purification, a second injection transformed his condition. His blood sugar plummeted, saving his life. The success didn't stop there. Soon, insulin was saving lives across the globe. Elizabeth Hughes, an 11-year-old who was severely malnourished, began insulin therapy in 1922. From being at death's door, she went on to live a full life until the age of 73. This small vial of hormone became more than a scientific discovery, it became hope for millions. In an extraordinary act of selflessness, Banting, Best, and Collip sold their patent to the University of Toronto for just $1 each. They believed insulin belonged to humanity, not to them. Banting famously declared, "Insulin doesn't belong to me, it belongs to the world." This decision ensured that insulin could be produced widely and affordably. By 1923, companies around the world were manufacturing insulin using methods shared freely by the Toronto team. Among these efforts was the work of Schack August Steenberg Krogh, a Danish Nobel laureate. Krogh's wife had diabetes, which motivated him to learn more about insulin. After visiting Toronto and witnessing its potential, Krogh secured the rights to produce insulin in Scandinavia. In 1923, the Nobel Prize in Physiology or Medicine was awarded to Banting and MacLeod. The decision was not without controversy. Banting was outraged that Best and Collip were excluded. The Nobel decision sparked debates for decades, with some arguing that earlier researchers, such as Eugene Glay, Georg Julzer, and Nicolae Paulescu, also deserved recognition for their contributions to the field. Despite the debates, the Toronto team's impact was undeniable. They turned insulin into a practical treatment, conducted vital physiological studies, and established scalable production methods. Their work brought hope where there had been none and transformed diabetes from a fatal condition into a manageable one. Frederick Banting became one of Canada's most celebrated figures, using his fame to further medical research. MacLeod, after years of criticism, eventually left Toronto for a professorship in Aberdeen. Best succeeded him as a professor at the University of Toronto. Meanwhile, the global production of insulin continued to grow, ensuring that millions could benefit from this life-saving discovery. The discovery of insulin is a testament to the power of teamwork, perseverance, and selflessness. Banting, Best, Colip, and MacLeod didn't just create a medical breakthrough, they left a legacy that continues to save lives and inspire the world. It's a story of science and humanity working hand in hand to bring light to those in the darkest moments of their lives. Insulin is more than a hormone, it's a symbol of what science and compassion can achieve together. At MedGenio, we celebrate such transformative milestones in medicine. Let this story inspire us all to believe in the power of perseverance and the impact of selflessness. Stay updated and subscribe for more stories that illuminate the journey of healing and hope.